Hi everybody, my name's Madison and I'm the creator of World Wide Web of Therapists. Today is episode 1 of the series, and let me introduce to you our first guest, Megan McDonald. Megan, why don't you introduce yourself to everybody?
Hi everyone, I'm Megan. I'm a board certified music therapist here in New Jersey. I'm a hospice music therapist, and I also work at St. Peter's Children's Hospital as a music therapist there.
Awesome. So the purpose of this channel is to encompass all the helping professions for like a place for other therapists to see, learn about other therapies and connect, and also for people who are seeking therapy or seeking therapy for loved ones to learn more about the therapies. So what got you into a helping profession? What's your journey into the helping profession field?
So I think just because my whole family is pretty much in the helping profession, my mom and sister are teachers, that was a big influence for me going into a helping career.
Mm-hmm.
And I just like giving back to my community and really helping everybody who may be underrepresented. So I think music therapy is a great way to do that.
Awesome. I totally agree, being a music therapist myself. I mean, shout out to music therapy. But
Yep.
So you said that you are a hospice music therapist as well as working in a children's hospital. Let's start off with the hospice music therapy. Can you tell us a little bit more about hospice music therapy, what you do in that setting?
Sure. It's usually a one-on-one session. So I'll go in, and it's usually bedside sessions that we have. Ooh, big fly. And sometimes the family is present, sometimes the caregivers are present also. And what we'll do is we'll work on fostering some old memories that the patient may have had, so playing some old tunes that they knew growing up that helped really shape them as a person.
Mm-hmm.
And we also do a lot of legacy work.
Awesome.
So that could be making CDs with the family that will help leave a lasting impression of the patient for them.
Yeah.
And we also do sometimes relaxation for the patients as well, because they could be experiencing a lot of pain.
Yeah.
And to work on some breathing too will always be helpful. It's a great technique.
That's great. What's something, like a story that you've had with a client that has really stuck out in your mind?
So I had one patient that I was seeing for only a few weeks, maybe about 2 or 3 sessions, and she was a pretty talkative patient, which sometimes that doesn't happen in hospice. But she wanted to learn how to play the guitar, and I'm sitting there thinking, how am I going to teach somebody to play the guitar who's laying in a hospital bed? So I gave her the guitar, I placed it in her lap, and she would strum the guitar for me, and I did all of the chord shapes on the upper part. And
awesome.
Together we sang, and she played Blue Moon, and
wow.
it's just something that really sticks out to me to this day.
I'm sure that was oh my gosh, I would be tearing up if I was in that
I think
situation.
I left the session and was just like, wow, it was amazing.
That sounds just like such a great memory. Your particular setting, because I know you don't know for everybody, what do they have to do to get music therapy?
So usually what will happen is either the nurse or the social worker, and sometimes even the chaplain too,
Okay.
because we do have that in a hospice setting, they will come to me and say, hey, this patient really likes music, or I think the family wants to request music therapy.
Mm-hmm.
So I'll go in and I'll do a little bit of an assessment with that patient.
Awesome.
And we'll start music therapy sessions after that.
Nice.
And I also do I'm in a lot of long-term care facilities, so I do a lot of advocating there to the staff of the actual facility too.
Oh, that's awesome.
Yeah.
Advocating in our field is huge.
Yes.
So you also mentioned that you're going to be working at a hospital. I know you haven't started yet, but would you like to tell what you'll be doing there?
Yeah, so I'm going to be a music therapist at a children's hospital.
Awesome.
Which is literally like one of my dream jobs. So I'm super excited. I'm going to be working a lot with oncology patients and people who are there long-term inpatients. And then also some short-term patients that come in on a need-by-need basis too. Yeah, so it'll be really cool. And we have the ukulele kids club there, so I will be teaching some patients the ukulele too.
That is such a great opportunity for them to get out of just the, you know, I like the ick of the hospital.
Yeah.
It's so sterile. So outside of your clinical work, have you done anything recently in the music therapy field that you'd like to share with everybody?
Yeah, I took a course about pediatric oncology and the use of music therapy within that population on Music Therapy Ed.
Awesome.
And it was with the music therapist at St. Jude's Children's Hospital. And it was a super interesting course. I recommend it for everybody who is especially interested in that medical setting with children. And we learned all about the different aspects of music therapy in a hospital setting. So we learned about all of the different professions that also work in the hospital: child life specialists, doctors, physicians, social work, everybody that makes up the interdisciplinary team. We also learned a little bit about how we can advocate in that setting for ourselves as music therapists, because advocacy is one of the biggest things.
Yes, absolutely.
For our field. And we learned about some goal setting and different interventions that could be used with that population.
So, where can our viewers connect with you?
So I am on Instagram. You can find me at Meg_the_MTBC.
Awesome.
And I also run a Redbubble shop where I post a lot of music therapy stickers, and at this point in time there's masks available that say "Ask me about music therapy," and just to advocate for our field. And because also I feel like we're kind of underrepresented in things you can find for our field. Like if you're a teacher, there's plenty of different t-shirts, graphics, all these things that you can find to kind of decorate yourself and represent your field.
That's so
and
true.
I wanted to find a way for music therapy to also be represented, mainly just from a personal view. I really wanted Redbubble stickers to decorate my laptop and my cases and everything for my instruments, so I figured why not start it there.
That's very smart. By the way, they're super cute. Go check them out. I am ordering a mask for when I start in the schools, because in New Jersey we're still required to wear masks out in public. So I'm gonna have a music therapist mask, because why not? It's so adorable. So to close up, I would like to ask, what's something that you want to share with the world? What's something that you want people to know, that really resonates with you? Maybe it's a quote, your personal mantra, anything like that you'd like to share with people.
So kind of my personal mantra, a little bit of a quote. I combined the two. It's creativity is contagious, so always spread it around.
I love that. Did you hear it? Creativity is contagious, so always spread it around. I'm gonna have to. You need a t-shirt with that on it.
I should make that. Yeah.
It's lovely. Well, thank you so much, Megan, for coming and interviewing with me. It was great to catch up and to share this first episode with you.
Yes, thank you for having me.
Of course. All right, bye guys.